A lumbar fusion in the lumbar spine is a very old procedure. It has changed dramatically from when it was initially performed, late 900s, and nowadays patient can go home on the same day. Now it's important to understand why a patient needs a fusion, and it's important to understand that not every fusion is the same. A fusion is when we put two vertebrae or more together. We indicate a fusion when the patient's back has too much mobility, or when the patient's back is not straight, they cannot stand up straight because they have a curvature that is not acceptable, or because we need to stabilize the spine after we remove part of critical areas of the spine, such as for an infection or tumor or fractures. When the fusion is needed, the decision is needed is clear: instability, deformity, or stabilization. The type of fusion, the way of doing it, that varies patients to patients. It could be done through the front of the abdomen, could be done through the side of the abdomen, could be done in the back, which is more commonly done. All have the same goals. However, recovery is not the same. Not everybody or not every patient is a candidate for all of them. But when they are, we obviously choose the one that is the least invasive with a faster recovery. Sometimes we need to use rods and screws, which doesn't sound like very appealing, but when the patient needs it, the outcomes are predictable and they're successful, and we know where the patient is going to be in 6 weeks, 3 months, or a year. A lot has been said about once you have a fusion procedure, because of overstress, other levels will pay the price. And the truth is that the natural history of those conditions is not much different. When you have a loose vertebra, that will be paying the price above and below unless it gets stabilized. Many patients that we fuse, they don't have a lot of mobility before surgery, so they don't lose any mobility. And the truth is, after surgery, regardless how many levels you have fused, mobility is not severely impaired. I have patients that are being fused from head to toe and they can still touch the floor. Every patient is different, of course. But again, every patient is different, every condition is different. There's different type of fusion, and we always like and perform the one that is the smallest with a faster recovery whenever it's possible. Feel free to call us, and feel free to call us before or after surgery for any questions or concerns.